listening to What's Your Wrinkle with Dr. Arthur Perry. What's your wrinkle?
And we are back. This is Dr. Arthur Perry. This is What's Your Wrinkle on our 10th anniversary show, 10 years on the radio in New York City and around the world. But tonight we've got Dr. Sadek, who is the medical director of adult and adolescent bariatric surgery at the Robert Wood Johnson University Hospital in New Brunswick, New Jersey. And Dr. Sadek, are you there?
Yes. Hi, Dr. Perry.
Great. Hi, thanks so much for taking time on your Saturday evening. Very exciting new development in bariatric surgery. For the listeners, bariatric surgery, I guess we define it as surgery that helps you lose weight. Is that a good definition for you?
Yes, I mean, for the public, it's better known as the surgery to help patients lose weight, but also not just to lose weight, but control a lot of other medical problems that come along with weight, like diabetes and high blood pressure, high cholesterol, sleep apnea, all the other, we call them comorbidities or diseases that tag along with obesity.
All right, so let's say someone is 20 pounds overweight. They're not a candidate for bariatric surgery, right?
Yes, it goes by body mass index, and if the body mass index is under 35, based on the NIH criteria, they are not candidates for the more invasive bariatric surgery procedures.
Right. So the BMI takes into consideration the height and the weight of the person, and but let's say someone is 100 pounds overweight. For the most part, they do qualify for bariatric surgery. Now there's different types of bariatric surgery. You've done gastric bypasses and lap bands and things like that. There's a new one called the ORBERA Intragastric Balloon. So I've been reading about this, but tell our listeners about this. What is it, and who's a good candidate for this one?
The ORBERA gastric balloon is a very, very exciting and very interesting device that is placed in the stomach. It has been used in Europe and Latin America for the last 10, 15 years. Just been approved by the FDA in the United States. And basically, it's a silicone-based balloon made of silicone that is placed in the stomach without surgery. It's placed endoscopically. No incisions, no general anesthesia, under sedation, and it's inflated with saline. And the amount of fluid that we inflate depends from one person to another, depending on the size of their stomach, obviously. And it's great for patients who have a body mass index between 30 or 35. Well, patients typically have about 30, 40 pounds to lose and don't want to go through an invasive procedure. The balloon remains in the stomach.
Yeah.
Go ahead.
Go right ahead. Keep talking about it. It's very interesting.
Yeah, the balloon remains in the stomach for about 6 months and gives the patient or the person the feeling that they're full. So it decreases the amount of food they consume, obviously, and regulates how many times they eat a day. So the person ends up eating 4 to 5 small meals a day and feels satisfied with a small amount of food. And that's what leads to a great weight loss. 6 months later...
So now, if you have this balloon, let me ask you now, if you have this balloon placed in your stomach, so you have an endoscopic procedure, and many of our listeners know what that is. A colonoscopy is an endoscopic type procedure, but we're going the other end here. We're going through your mouth, and we're placing this balloon in your stomach. What happens if someone vomits? What happens to the balloon then?
The balloon remains in the stomach. It cannot pass. There are 2 valves in the stomach, one on the top part of the stomach where it connects to the esophagus, called the gastroesophageal valve, and one on the bottom part, which is called the pylorus. So basically the stomach is sort of a closed bag. And even if somebody feels nauseous or gets some sort of a virus or something that they need to throw up, they can still throw up with the balloon in place. But this does not disrupt the balloon. It doesn't lead to anything.
So how much weight can someone lose with this?
So the typical weight loss based on the studies were about 30 to 40% of their extra body weight. So let's say somebody has about 40 pounds to lose or 50 pounds to lose. They can lose up to 20 to 25 pounds of this. That's on average. So includes patients who've lost less and patients who've lost more. But typically, patients will lose 25, 30 pounds at least in the 6 months.
Now, after they've lost that weight, do you leave it in and deflate it just in case they gain more weight, or do you take it out?
You take it out. So it's only approved to stay in for 6 months. So we go in, we deflate it endoscopically, and we remove it. And the concept behind it is that we've already educated the patient, and we've already readjusted the body to eating few small meals and controlling the diet, obviously. Of course, it's accompanied with a lot of follow-up and nutritional evaluations and exercise and the other aspects of weight loss.
Well, it's a very exciting development in bariatric surgery, and I want to thank you, Dr. Sadek, the medical director of bariatric surgery at Robert Wood Johnson University Hospital. And by the way, if you're interested in learning more about this procedure, go to the Robert Wood Johnson website, rwjuh.edu. That's rwjuh.edu. On the internet. It's a great website. You'll find all sorts of information. If you're interested in finding a doctor like Dr. Sadek who does this procedure, go to the website or give a call. It's a 24-hour hotline at Robert Wood Johnson, 888-MD-RWJUH. So that's, once again, 888-MD-RWJUH. You can give them a call and get a referral that way. Well, thank you so much for taking time on your Saturday evening. Dr. Sadek, the medical director of bariatric surgery at Robert Wood Johnson University Hospital in New Brunswick, New Jersey. I'm Dr. Arthur Perry. I'm a plastic surgeon. And, yes, I'm on the staff of Robert Wood Johnson also, doing my cosmetic surgery there every week. And I want to thank everybody for listening to this show throughout 10 years. Thanks a lot for great engineering. We'll see everybody in 2 weeks. We're preempted by football next week. Thanks a lot, Mike. Thanks, Jennifer. See everybody next 2 weeks.